2 of the coronavirus pandemic has accelerated the pace of change throughout Philadelphia College of Osteopathic Medicine and across healthcare. Yet, we have done far more than adapt. We have thrived. At PCOM, ours has been a commitment to academic vigor, to pioneering research and innovation, to racial justice, diversity, and inclusion, to a strengthened clinical service capacity, to health and wellness engagement with our local communities, and to an enlargement of student living and learning resources. Furthermore, we have moved from the planning process for our strategic plan to the implementation of a significant number of tactics. The plan will position our college for continued and future success and provide a clear path to greater excellence. I invite you to view our 2021 President's Report, which articulates our accomplishments during this time. I have never been more proud of our college community. Thank you. This past year, the college instituted a Medical Education Center of Excellence, the first of its kind in the nation. Known by the acronym MECO, the center strengthens the college's ability to prepare the next generation of osteopathic physicians. MECO provides faculty and administrative expertise and supports the delivery of the PCOM 1 curriculum. This affords many unique advantages for PCOM students. From day one, students learn through relevant, diverse, and equitable curricula, novel teaching tools and software, and exacting assessments and outcomes. MECO directors ensure the progress of each individual student throughout their educational journey. This past year, the Accreditation Council for Pharmacy Education granted the PCOM Doctor of Pharmacy program 8 years of continued accreditation. PCOM's 3-year Education Special Degree program was granted accreditation by the National Association of School Psychologists, and PCOM's Doctor of Physical Therapy program was granted initial accreditation effective through fall 2025 by the Commission on Accreditation in Physical Therapy Education. The college also launched new graduate program offerings in Applied Behavior Analysis, Medical Laboratory Science, and Applied Positive Psychology. Research at PCOM focuses on advancing science and medicine through basic, translational, clinical, behavioral, educational, and community-based studies across 3 locations. Research is supported internally through a small grants program and by external funding from the NIH, NSF, research institutes, departments of health, associations, foundations, companies, and donors. As part of the PCOM mission, students receive training in research methodologies and are important contributors to research studies. PCOM currently has over $15 million in external funds for research, including 10 new industry-sponsored contracts. 3/4 of research funding at the college comes from external sources. This past year, interdisciplinary faculty and staff conducted research on approaches to COVID-19 disease progression prediction, treatment, prevention, and impact on healthcare delivery. In addition, PCOM, in collaboration with its clinical registrant partner, Organic Remedies, furthered efforts on a multi-study research program that investigates medicinal cannabis use across populations, its impact on behavioral health and quality of life, and therapeutic applications for the treatment of chronic pain and opioid use disorder. 6 research studies received approval from the IRB and Joint Development Committee. This past year, the PCOM community renewed its collective vow to ensure that racism has no place at the college or in the broader community. The President's Commission on Racial Justice, Transforming Campus Culture, composed of 5 working groups, is examining the distribution of college resources to address equity, racism, and bias. The Commission has documented strategic priorities and is making progress on actionable steps that align with the PCOM 2025 Diversity, Equity, and Inclusion Plan. Additional work by the Office of Diversity and Community Relations supports students, faculty, and staff by providing learning, outreach, and development opportunities that reflect an accountability to diversity as the foundational element of excellence. Renovation and expansion of family medicine at PCOM was realized this past year as a result of a combination of grants, donations, and college investments. The project, which included the conversion of existing corridor and retail spaces to expand waiting and lobby functions, as well as exam and supportive patient rooms, will significantly increase clinical service capacity. Construction continues in the space adjacent to family medicine at PCOM. The expectation is that VIBE will refer patients to family medicine at PCOM for follow-up, to identify a primary care provider, and for chronic care management. The healthcare center also serves as an official clinical training site for PCOM students. The students gain a knowledge of health promotion, disease prevention, diagnosis, and treatment while learning innovative strategies to deliver patient-centered primary care. PCOM has long valued the role of community outreach in healthcare education. By emphasizing care for underserved populations, the college cultivates a culture of holistic health and well-being as a core value of community, a manifestation of our whole person approach. To that end, the President's Community Wellness Initiative was formed to create educational, research, and health services programming and resources that improve and sustain the physical, mental, and nutritional wellness of the college's surrounding communities. The CWI supports existing projects and new collaborative efforts to serve the community. This past fiscal year, $160,000 was raised for CWI initiatives, including a $100,000 title sponsorship from Independence Blue Cross. PCOM continued to build on the success of the previous year and closed fiscal year 2021 with the largest fundraising total in the college's history. Because of the strong ties it has built with donors, trustees, faculty, staff, alumni, and friends, the college continues to secure an impressive level of philanthropy. Commitments totaling $9,467,820 will enable the college to work to fulfill its strategic vision and continue to attract the best and brightest students. Not only does PCOM community give their dollars, they also give their time. A record number of alumni volunteer to mentor, guide, and advise our students. This past spring, the college opened Meta Christi House, located adjacent to the PCOM campus. Previously known as Overmont House, the newly renovated facility includes 224 fully furnished apartments on 12 floors. The building is named in honor of Meta L. Christi, D.O. 1921, the college's first African-American student and the first African-American doctor of osteopathic medicine in the nation, as recognized by the American Osteopathic Association. The 100th year anniversary of her graduation from PCOM was marked in special ways throughout the year. The Moultrie-Colquitt County Development Authority, with local government and organizations, has allocated an additional $5 million in commitments to support the growth of PCOM South Georgia. If matched by the state of Georgia, the college could add significant support for facility and program expansion. Specific plans for growth at PCOM South Georgia are still to come, but will likely include new academic programs that will address the severe deficit of certain healthcare providers in the state and region. Among them are occupational therapists and mental health practitioners. New programs would have a positive economic impact on the South Georgia region. With approval from the PCOM Board of Trustees, the college launched PCOM 2025, a comprehensive strategic plan, in January 2021. PCOM 2025 guides our ambitions, continuous improvement efforts, and institutional investments. It positions the college for continued and future success and provides a clear path to greater excellence. The plan's vision pivots on transforming health professions education by integrating human connection with innovation and research. A significant number of tactics were completed during this past fiscal year, advancing key goals in the areas of student success, securing clinical experiences, innovation and technology, organization infrastructure, revenue stream diversification, and diversity, equity, and inclusion. The plan continues to drive action across our college, and we are encouraged by the extraordinary progress we have made to date.